In this video, we will talk about who is strictly forbidden to drink coffee. Although for many people this flavorful beverage is a source of energy and pleasure, for some it can cause serious health problems. We will look at what diseases can be aggravated by drinking coffee and why this drink should be urgently excluded from your diet. If you want to know how coffee can affect your health and who needs to be especially careful with it, be sure to watch this video to the end. This video will be extremely informative and helpful. So, if you want to become a master of your health, click like, and let's get started. Number 1. Hypertension and cardiovascular disease, heart failure, arrhythmia, tachycardia. Coffee has long been a symbol of waking up in the morning, but for people suffering from hypertension and cardiovascular disease, this familiar beverage can pose a serious threat. One of the main reasons for this is caffeine, which stimulates the central nervous system and can dramatically increase blood pressure. For people with hypertension, every rise in blood pressure can be potentially dangerous, especially if it happens suddenly. Caffeine can cause vasoconstriction, the constriction of blood vessels, which puts more strain on the heart and vascular system. Studies show that drinking even 1 cup of coffee can raise blood pressure by 8 to 10 millimeters of mercury column within the first 30 minutes of consumption. This may seem insignificant to a healthy person, but for hypertensive individuals, such fluctuations can cause serious complications. One study published in the journal Hypertension confirmed that people with hypertension experience a greater increase in blood pressure after drinking coffee compared to those with normal blood pressure. This can lead to acute conditions such as hypertensive crisis, especially in people taking blood pressure-lowering medications. But it's not just hypertensive people who are at risk. People with chronic heart conditions, such as arrhythmia or heart failure, should also avoid excessive caffeine consumption. Caffeine stimulates the release of adrenaline, a hormone that can increase heart rate and cause tachycardia. In one clinical case described in the Journal of the American College of Cardiology, a patient with arrhythmia was hospitalized with atrial fibrillation after consuming large amounts of coffee and energy drinks. His condition required urgent medical intervention, and it was only through cardiac pacing that his heart rhythm was restored. In addition, caffeine can interfere with the effect of some drugs designed to regulate heart activity. It can neutralize the effect of antihypertensive drugs, increasing symptoms and creating dangerous situations for patients. Therefore, it is important for people suffering from cardiovascular disease to discuss with their doctor the possibility of drinking coffee or to limit it to a minimum. Statistics also support the dangers. A study conducted by the American Heart Association found that regular consumption of coffee in high doses is associated with an increased risk of heart attacks in people with pre-existing heart disease. Even moderate doses of caffeine can have a significant impact on cardiac stability. Real-life stories underscore this threat. In one famous case, a 53-year-old man who suffered from hypertension regularly consumed 5 to 6 cups of coffee a day. One day, he suffered a myocardial infarction after the severe stress that accompanied his coffee consumption. This served as a reminder that for people with cardiovascular problems, coffee can be the last straw. The bottom line is that if you suffer from hypertension or cardiovascular disease, you should take the issue of coffee consumption seriously. Moderation, regular consultation with your doctor, and replacing coffee with gentler beverages are key to staying healthy. Number 2. Gastritis, peptic ulcer disease, reflux esophagitis, GERD, irritable bowel syndrome, IBS, and chronic intestinal diseases. Coffee, with its bright flavor and stimulating properties, is a popular beverage, but its effects on the gastrointestinal tract can be detrimental, especially for those who suffer from gastritis, peptic ulcer disease, reflux esophagitis, and irritable bowel syndrome, IBS. Coffee contains a number of chemical compounds, including caffeine and chlorogenic acid, which stimulate the production of stomach acid. For people with gastritis or peptic ulcers, this can be disastrous, as the increased acidity irritates the already inflamed mucous membranes of the stomach. In a clinical study in the European Journal of Gastroenterology and Hepatology, it was shown that even 1 cup of coffee can cause a significant increase in stomach acid levels in patients with gastritis and peptic ulcer disease, making their symptoms worse and treatment more difficult. Case studies support these findings. In one case, a patient with duodenal ulcer was admitted to the hospital with acute abdominal pain after drinking 3 cups of strong coffee on an empty stomach. The pain was so severe that doctors suspected perforation of the ulcer, which is a serious and life-threatening condition. The patient had to undergo emergency surgery to avoid complications. For people with reflux esophagitis, GERD, the situation can be just as challenging. Caffeine weakens the lower esophageal sphincter, the muscle that prevents stomach contents from backing up into the esophagus. This exacerbates the symptoms of heartburn and acid reflux that are characteristic of GERD. A study conducted by the American Gastroenterological Association found that patients who regularly drink coffee are significantly more likely to have frequent and severe episodes of heartburn. In one interesting case, a patient with GERD noticed that each cup of coffee worsened his symptoms, and after completely withdrawing from caffeinated beverages, his symptoms were significantly reduced. Irritable bowel syndrome, IBS, and chronic bowel diseases such as ulcerative colitis and Crohn's disease can also be aggravated by coffee consumption. Caffeine stimulates intestinal peristalsis, which can lead to increased frequency and intensity of pain and cramping in patients with these conditions. In addition, irritants in coffee can increase inflammation in the intestines, leading to exacerbations. Statistics prove it. About 30% of IBS patients report worsening after drinking coffee, especially on an empty stomach. In one real-life case, a patient with Crohn's disease who consumed several cups of coffee a day regularly experienced exacerbations. Only after giving up coffee completely did his condition stabilize, allowing him to better control his symptoms and reduce the frequency of attacks. Thus, for people with gastritis, peptic ulcer disease, reflux esophagitis, and irritable bowel syndrome, coffee poses a serious risk. Its regular consumption can not only worsen symptoms, but also lead to severe complications that require medical intervention. The best solution for such people is to completely eliminate coffee or replace it with drinks that are gentler on the gastrointestinal tract. Number 3. Problems with the kidneys, liver, and urinary system. Coffee can be dangerous for people suffering from kidney, liver, and urinary system problems. The powerful stimulants in coffee, including caffeine, can put extra strain on these organs, which can lead to complications, especially if a person already has a predisposition to these conditions. The kidneys are one of the key organs responsible for eliminating toxins from the body. They filter about 200 liters of blood per day, removing excess fluid and metabolic waste products. However, coffee can disrupt this delicate process. One of the side effects of caffeine is its diuretic effect, which can lead to dehydration, which in turn increases the strain on the kidneys. For people with chronic kidney disease, this can be especially dangerous, as dehydration increases the progression of the disease. Medical cases support this risk. One patient with chronic kidney failure regularly consumed up to 5 cups of coffee a day. He reported frequent attacks of low back pain and increased visits to the doctor due to worsening symptoms. After being advised by his doctor to reduce his coffee consumption, his condition improved significantly. Research published in the American Journal of Kidney Diseases shows that high doses of caffeine can upset the balance of electrolytes such as sodium and potassium, which also negatively affects kidney function. In patients with chronic kidney disease, regular coffee consumption is associated with impaired filtration and increased symptoms of chronic renal failure. The liver plays a central role in the metabolism of caffeine and other compounds found in coffee. For people with liver disease, such as cirrhosis or fatty liver disease, excessive coffee consumption can be particularly harmful. Although small amounts of coffee can have a protective effect on the liver, excessive caffeine consumption can worsen its condition. Studies have shown that caffeine is metabolized in the liver by cytochrome P450 enzymes. However, in people with liver disease, caffeine metabolism can be impaired, leading to a buildup of the substance in the blood. In one real-life case, a patient with fatty liver disease who consumed more than 8 cups of coffee a day experienced a worsening of his condition and an exacerbation of the disease. Doctors noted that his liver enzymes were out of the normal range, leading to the need for hospitalization. Evidence from studies published in the journal Hepatology suggests that even moderate coffee consumption can increase the risk of complications in people with liver disease, especially if they are already taking medications metabolized in the liver. Coffee can also negatively affect people who suffer from urinary system disorders, such as bladder infections or urolithiasis. As mentioned earlier, caffeine has a diuretic effect, which can lead to dehydration, increasing the risk of kidney stones. Lack of fluid in the body makes it difficult for the body to excrete salts and minerals, which contributes to stone formation. In addition, coffee can irritate the bladder mucosa, which is especially dangerous for people with chronic urinary tract infections. A study in the International Urogynecology Journal found that coffee consumption increases the likelihood of bladder irritation, leading to more frequent and painful urination in patients with pre-existing problems. Thus, for people with kidney, liver, or urinary system problems, coffee can pose a serious risk. Its diuretic action, stimulant properties, and effect on electrolyte balance can lead to exacerbation of symptoms and even severe complications. The best recommendation for these patients is to limit or completely eliminate coffee from the diet to reduce the risk of worsening the condition and maintain health. Number 4. Pancreatitis and chronic pancreatic diseases. Coffee can be a dangerous beverage for people with pancreatitis or chronic pancreatic disease. The pancreas is the organ that is responsible for producing enzymes needed for digestion and hormones that regulate blood sugar levels. When its function is impaired, it leads to serious health problems. Coffee consumption in such diseases can aggravate the symptoms and provoke exacerbations. Pancreatitis is an inflammation of the pancreas, which can be acute or chronic. In an exacerbation of pancreatitis, the pancreas stops functioning normally, which causes severe pain, nausea, vomiting, and other unpleasant symptoms. The caffeine in coffee can stimulate the secretion of gastric juice and pancreatic enzymes, which puts additional strain on this organ. In one case, a 45-year-old patient suffering from chronic pancreatitis told doctors that his abdominal pain increased after each cup of coffee. After he eliminated coffee from his diet, his condition improved significantly and the frequency of exacerbations decreased. Research published in Digestive Diseases and Sciences confirms that caffeine increases the secretion of pancreatic enzymes, which may contribute to increased inflammation in people with pancreatitis. Even small doses of coffee can cause discomfort and worsen conditions in people with chronic disease of this organ. For people with chronic pancreatic diseases such as chronic pancreatitis, coffee can be a trigger for exacerbations. The fact is that coffee contains not only caffeine, but also other compounds such as chlorogenic acid, which can stimulate the digestive system and increase inflammation. People with chronic pancreatitis often have difficulty digesting food and metabolic problems, and coffee only exacerbates these problems. Research conducted by scientists at the Journal of Gastroenterology and Hepatology shows that in patients with chronic pancreatic disease, coffee can cause increased abdominal pain, dyspepsia, and other symptoms associated with digestive disorders. In one clinical case study, a patient with chronic pancreatitis regularly experienced severe pain and dyspepsia after drinking coffee. Her doctors recommended that she completely eliminate caffeine from her diet, which resulted in a significant improvement in her condition. This example emphasizes the importance of dietary adjustments for people with pancreatic disease. Thus, for people with pancreatitis or chronic pancreatic disease, coffee can be extremely harmful. Its stimulating effect on the secretion of enzymes and acid can provoke an exacerbation and intensify the symptoms of the disease. Doctors recommend that such patients avoid coffee and choose alternative beverages to minimize the strain on the pancreas and reduce the risk of complications. Number 5. Osteoporosis, calcium deficiency, and bone problems. For those who suffer from osteoporosis, calcium deficiency, or other bone system problems, coffee may not be safe. The effect of caffeine on calcium metabolism and bone density is a serious issue that requires careful attention to diet. Studies show that caffeine can interfere with calcium absorption in the body. Calcium is the primary mineral needed to maintain bone strength. Consuming coffee in large amounts leads to increased excretion of calcium through the urine, which over time can lead to a deficiency of this vital mineral. For example, a study published in the American Journal of Clinical Nutrition found that women who drank more than 3 cups of coffee a day had significantly lower bone density compared to those who drank coffee in moderation or avoided it altogether. This makes them more vulnerable to osteoporosis and fractures. Osteoporosis is a disease characterized by loss of bone mass and an increased risk of fractures. The problem of osteoporosis is particularly acute in the elderly and postmenopausal women when the natural loss of bone mass increases due to hormonal changes. A clinical case from the practice of an orthopedist describes a patient with osteoporosis who continued to drink coffee 4 cups a day. After a series of fractures and decreased bone mass, her doctor recommended that she stop drinking caffeine altogether. After that, her condition stabilized and her bone density stopped declining. Also interesting is a case study conducted by scientists from the Journal of Bone and Mineral Research. The experiment involved elderly women who were found to have an association between increased caffeine consumption and an increased incidence of fractures. The researchers concluded that caffeine increases the leaching of calcium from bones, especially in those who already have bone problems. In addition, coffee has a cumulative effect on the body. If a person is already calcium deficient, regular coffee consumption can exacerbate the problem. Calcium deficiency weakens the bones, making them more brittle and prone to damage from even minor injuries. Plenty of scientific evidence suggests that people with calcium deficiency should avoid caffeine. For example, a study conducted by scientists at the Harvard School of Public Health found that regular caffeine consumption increases the risk of osteoporosis by 20% in women over the age of 50. Thus, for people with osteoporosis, calcium deficiency, and other bone problems, doctors recommend either eliminating coffee from the diet completely or significantly limiting its consumption. Alternatives are decaffeinated coffee or herbal drinks that do not affect the calcium balance in the body. Number 6. Type 2 diabetes and sugar metabolism disorders. For people with type 2 diabetes or sugar metabolism disorders, coffee can be dangerous, especially when consumed in excess. The caffeine in coffee has significant effects on blood glucose levels and insulin sensitivity, making it potentially harmful for people with these conditions. Research suggests that caffeine may impair blood sugar control in people with type 2 diabetes. In one study published in Diabetes Care, scientists found that participants with type 2 diabetes had an 8 to 10% increase in blood sugar levels after consuming coffee compared to a control group. This is because caffeine can reduce the body's sensitivity to insulin, which prevents cells from absorbing glucose normally. Moreover, a study conducted by scientists from Duke University found that diabetic patients who drank coffee daily experienced spikes in blood sugar levels throughout the day. These fluctuations made it difficult to control the disease and increased the risk of long-term complications such as damage to blood vessels, nerves, and organs. For people with prediabetes or sugar metabolism disorders, coffee may increase the risk of developing insulin resistance. Insulin resistance is a condition in which the body's cells become less sensitive to the action of insulin, resulting in elevated blood glucose levels. An interesting case from medical practice concerns a patient who was diagnosed with impaired glucose tolerance. Despite the doctor's warnings, he continued to drink coffee 3 cups a day. A few months later, he was diagnosed with type 2 diabetes, and the doctor determined that coffee was one of the factors that exacerbated his condition. Despite coffee's negative effects on blood sugar levels, there are studies that show that coffee can reduce the risk of developing type 2 diabetes in some people. For example, a study published in the American Journal of Clinical Nutrition found that regular coffee consumption was associated with a lower risk of diabetes in healthy people. However, for those who already have diabetes or sugar metabolism disorders, these findings do not apply. For them, it is important to monitor their caffeine intake and monitor their body's response to caffeine consumption. This is especially important when using sugar substitutes added to coffee, as they can further increase the risk of sugar spikes. Thus, people with type 2 diabetes and sugar metabolism disorders are advised to limit their coffee consumption or avoid it altogether. Doctors advise to closely monitor the body's reaction to coffee and use it in moderation, if tolerated. Alternatives are herbal teas or decaffeinated coffee, which do not have the same effect on blood sugar levels. It is also a good idea to consult with your doctor before making dietary changes. For example, one diabetic patient who consulted a nutritionist switched to decaffeinated coffee and noticed a significant improvement in his blood sugar control, allowing him to better manage his disease. Number 7. Iron deficiency anemia and mineral deficiency. For people with iron deficiency anemia and mineral deficiency, drinking coffee may not be desirable. The fact is that caffeine and other substances in coffee can reduce the body's ability to absorb essential minerals such as iron, zinc, and calcium. This is especially dangerous for people who suffer from anemia and deficiencies of important elements, as regular coffee consumption can aggravate their condition and lead to the development of additional health problems. Studies show that coffee can interfere with the absorption of non-heme iron, a type of iron found in plant foods and supplements. According to findings published in the American Journal of Clinical Nutrition, even 1 cup of coffee drunk with a meal can reduce iron absorption by 40 to 60%. This is due to the action of polyphenols and tannins found in coffee, which bind to iron in the intestines, making it more difficult to absorb into the bloodstream. In one case described in medical practice, a woman with chronic iron deficiency anemia went to the doctor complaining of worsening health and falling hemoglobin levels despite taking iron supplements. A discussion of her diet revealed that she had been drinking coffee immediately after her meals and supplements. After being advised to give up coffee for the duration of her treatment, her condition improved significantly. Coffee also affects the absorption of other minerals such as calcium and zinc. Studies show that regular coffee consumption can increase urinary excretion of calcium, which is especially dangerous for people with osteoporosis and calcium deficiency. For example, one study published in the Journal of Bone and Mineral Research confirmed that women who drink more than 3 cups of coffee a day have an increased risk of losing bone mass and developing osteoporosis. In addition, coffee can interfere with the absorption of zinc, which is important for the immune system, wound healing, and hormone regulation. For people deficient in this element, coffee can exacerbate the deficiency and lead to poor health. People with iron deficiency anemia are especially vulnerable to the effects of coffee because their bodies need more iron to maintain normal hemoglobin levels. Iron deficiency anemia can cause severe fatigue, weakness, dizziness, and shortness of breath. In one case, a patient with severe anemia continued to drink 4 cups of coffee a day, unaware of its effect on iron absorption. After her doctor explained the problem, she reduced her coffee intake and added more iron-containing foods and supplements to her diet, which led to an improvement in her condition. Therefore, it is important for people with iron deficiency anemia and mineral deficiency to control their coffee intake. Doctors recommend avoiding coffee immediately after meals or together with iron supplements. It is also helpful to take iron supplements or iron-rich foods with foods rich in vitamin C, which improves iron absorption instead of coffee. One option is to drink coffee 2 to 3 hours after taking food or supplements to minimize its effect on mineral absorption. It is also worth considering replacing regular coffee with decaffeinated coffee, which has a lesser effect on the absorption of iron and other minerals. Thus, moderation and proper timing when drinking coffee can help avoid negative effects for people who are deficient in iron and other minerals. Number 8. Glaucoma and increased intraocular pressure. Glaucoma is a chronic eye disease in which intraocular pressure increases, which can lead to optic nerve damage and eventually blindness. One factor that can aggravate this condition is caffeine, especially found in coffee. For people who suffer from glaucoma or tend to have high intraocular pressure, coffee can be a serious threat to eye health. Studies show that drinking coffee can temporarily increase intraocular pressure. This is because caffeine stimulates the central nervous system, including stimulation of adenosine receptors, which can disrupt the balance of fluid in the eye. As a result, intraocular pressure rises, which is especially dangerous for people with glaucoma. According to a study published in the Journal of Ophthalmology, after drinking 1 cup of coffee, intraocular pressure can increase by 1 to 2 millimeters of mercury column, mmHg, within 90 minutes. For healthy people, this temporary increase in pressure is usually not a serious threat, but for glaucoma patients, even a small increase in intraocular pressure can become critical and accelerate vision loss. One real-life case involved a 56-year-old man suffering from chronic open-angle glaucoma. Despite doctors' orders to avoid coffee, he continued to drink 3 cups a day. Soon his vision began to deteriorate, and he noticed an increase in his blind spots. After consulting an ophthalmologist and stopping coffee consumption, his condition stabilized and further deterioration of his vision was prevented. This case further emphasizes the importance of controlling coffee consumption in glaucoma. A major study conducted at Harvard Medical School found that people who consumed more than 3 cups of coffee a day had a 66% higher risk of developing elevated intraocular pressure than those who drank coffee less frequently or avoided it altogether. This effect was especially pronounced in those who had a genetic predisposition to glaucoma. Also, in a study published in Investigative Ophthalmology and Visual Science, it was shown that regular coffee consumption may not only increase intraocular pressure, but also accelerate the progression of glaucoma in people already suffering from the disease. For people with glaucoma or a tendency to have elevated intraocular pressure, it is crucial to limit caffeine intake. Doctors recommend not drinking more than 1 cup of coffee a day or avoiding coffee altogether in favor of alternative beverages such as decaffeinated coffee, herbal teas, or green tea, which have antioxidant properties and do not have the same effect on intraocular pressure. It is also worth remembering that caffeine is not only found in coffee, but also in other drinks such as tea, energy drinks, and some medications. Therefore, it is important to keep a close eye on your total caffeine intake throughout the day. Thus, if you suffer from glaucoma or have elevated intraocular pressure, moderation in coffee consumption is an important step towards preserving your vision. Consulting with your doctor and being aware of your condition will help you avoid irreversible effects on your eye health. Number 9. Insomnia, anxiety disorders, nervousness, and depression. Coffee is a powerful central nervous system stimulant due to its high caffeine content. This stimulant helps to wake up in the morning and keep energy levels high throughout the day. However, for people who suffer from insomnia, anxiety disorders, nervousness, and depression, coffee can be a real problem, aggravating their condition. Caffeine acts as a blocker of adenosine, a neurotransmitter that is responsible for relaxation and drowsiness. When caffeine blocks adenosine receptors, the brain remains in an activated state, which can interfere with sleep. Studies show that caffeine taken even 6 hours before bedtime can significantly reduce overall sleep time and sleep quality. People who suffer from insomnia often find that even small amounts of caffeine throughout the day can exacerbate their trouble falling asleep and disrupt their natural sleep cycles. One telling example is the story of a 35-year-old woman suffering from chronic insomnia. Despite her doctor's warnings, she continued to drink coffee, believing that a few cups a day could not seriously affect her sleep. However, her insomnia gradually developed into more serious problems with her nervous system, including anxiety disorders and severe nervousness. When she gave up coffee completely, her condition began to improve. Her sleep became deeper, and her anxiety levels decreased. A study published in the Journal of Clinical Sleep Medicine showed that even small doses of caffeine taken 6 hours before bedtime can shorten sleep duration by 1 hour. At the same time, caffeine can persist in the body for up to 10 hours, making it harder to fall asleep and impairing sleep quality. For people who already suffer from insomnia, this effect can be devastating. In addition, caffeine can exacerbate anxiety disorders. According to a study published in the Journal of Anxiety Disorders, people with anxiety disorders who consumed more than 200 milligrams of caffeine per day reported a significant worsening of their condition. This is because caffeine stimulates the production of adrenaline and cortisol, which increases feelings of anxiety and panic. For people suffering from depression, coffee can also prove to be a problem. While small doses of caffeine can sometimes improve mood, regular and excessive coffee consumption can worsen depression by increasing anxiety levels and sleep disturbances. Lack of sleep, in turn, is a key factor in poor mental health. An interesting case was reported in 2018 when a 28-year-old man with depression and anxiety disorders increased his coffee consumption to 5 cups a day to combat chronic fatigue. Instead of feeling more alert, his condition worsened. He began suffering from severe panic attacks and bouts of depression. After giving up coffee completely, his anxiety and depression gradually decreased. Thus, for people with insomnia, anxiety disorders, and depression, coffee is not a suitable beverage. If giving up coffee seems difficult, it's worth considering switching to low-caffeine drinks, such as green tea or herbal teas, which can help calm the nervous system. It's also important to remember that caffeine is found in chocolate, energy drinks, and some medications. So it's important to keep an eye on your overall caffeine intake. Experts recommend that people with mental disorders avoid drinking coffee, especially in the afternoon, to minimize its negative effects on the nervous system and sleep. Number 10. Pregnancy and breastfeeding. Pregnancy and breastfeeding are important periods in a woman's life when the health of the unborn child and the mother are under close scrutiny. One of the controversial issues is the consumption of coffee and caffeine during this period. Studies show that caffeine passes through the placenta and can affect fetal development, as well as being passed through breast milk, which can have an impact on the newborn. Caffeine easily passes through the placental barrier, but the fetal body is not able to metabolize it as efficiently as an adult's body. This can lead to a buildup of caffeine in the fetus and cause potential risks. Research published in the Journal of Maternal Fetal and Neonatal Medicine shows that consuming more than 200 milligrams of caffeine per day during pregnancy can increase the risk of miscarriage, preterm labor, and low birth weight. One real-life case was reported in 2019 when a 32-year-old pregnant woman with a habit of drinking up to 5 cups of coffee a day faced complications. Doctors warned her to reduce her caffeine intake as the fetus showed signs of hypoxia. After reducing her coffee consumption to 1 cup a day and switching to gentler drinks, her pregnancy progressed more steadily. Caffeine can also affect the fetus's cardiovascular system, increasing the risk of arrhythmias and hypertension in the future. The American College of Obstetricians and Gynecologists recommends limiting caffeine intake to 200 milligrams per day, which is about 1 cup of medium-sized coffee. However, many experts advise completely eliminating coffee during pregnancy, especially in the first trimester, when all of the baby's vital organs are being laid down. During breastfeeding, caffeine is also dangerous, as it can penetrate the breast milk and affect the newborn. The infant's body is not able to process and excrete caffeine quickly, which can lead to a buildup of caffeine in the body and cause anxiety, irritability, and sleep disturbances in the child. Consider the case of a 26-year-old mother who was unaware of the effects of caffeine on breast milk and continued to drink 2 to 3 cups of coffee a day after giving birth. Her newborn baby began to show signs of severe anxiety, sleeping poorly, and crying frequently. After consulting with her doctor, she reduced her coffee consumption to 1 cup and noticed a significant improvement in her child's behavior. Research published in the Journal of Pediatrics has shown that even small doses of caffeine in breast milk can have a noticeable effect on infant behavior. It is recommended to minimize caffeine intake during breastfeeding or eliminate it completely if the baby shows signs of irritability or insomnia. Thus, pregnancy and breastfeeding are periods when you should be particularly careful about your diet. Coffee consumption can affect both the health of the mother and the development of the child, so it is recommended to limit caffeine intake to minimal doses or eliminate it completely during pregnancy and breastfeeding. Now that you have learned who is contraindicated to drink coffee, it is important to understand how to consume it correctly and safely. The main thing is to observe moderation and take into account the peculiarities of your body. First, if coffee is part of your diet, try not to exceed the acceptable norm of caffeine, 400 milligrams per day, which is equivalent to 4 cups. But if you have medical conditions such as hypertension, stomach problems, or glaucoma, it's important to consult your doctor to determine your tolerance. Secondly, choose the right time for coffee. The ideal time for the first cup is an hour after waking up. The last cup is better to drink at least 6 hours before bedtime to avoid problems falling asleep and overstimulation of the nervous system. Avoid drinking coffee on an empty stomach. This can lead to irritation of the mucosa and exacerbation of gastritis. It is better to drink it after a dense breakfast or lunch. Do not forget about the quality of your drink. Choose coffee from fresh beans. Avoid excessive amounts of sugar, artificial additives, and combinations with energy drinks. Coffee can remain an enjoyable part of your life if you approach it with caution. Enjoy it, but always be mindful of your individual limitations so you don't compromise your health. What do you think about this? Do you agree with these statements? If there are any questions, ask them in the comments. More information on this topic can be found at the links in the description below this video and on our channel.
Subscribe and hit the bell for all notifications. Please like and share this video with your friends. Thanks to our sponsors for their support. I eagerly await your comments and encourage you to watch these useful videos.